Yeah, man. Good evening, people. Good evening. Delvin Sadler, Medea. Yeah, man. Delvin is here. And this is your Saturday episode of Unscripted. Anything goes. Beautiful people, I love you. Yeah, man. Beautiful people, I love you. Yeah, man. Thanks for joining Unscripted. Anything goes. Today is Saturday. Yeah, man. Beautiful Saturday. Yeah, man. Today is the day where everybody, yeah, man, clean up the house, clean up the yard. Yeah, man. Cook your Saturday soup. Yeah. Cook your Saturday soup. And then, and little more, you go and party. Yes, Rastafari, Delvin. Yeah, man, Delvin, straight up. I love you guys. The lovely Trika. Big up yourself, girl. Trika Atkinson. Yeah, man. Straight up, girl. Delvin. Yeah, man. Me nah hide and talk. I love you. Yeah, man. I love you. Delvin hide and talk. Me come straight to the point. I love you, Trika. Yeah, man. Straight up. Yes, my brother. Yeah, man. Because of that. Sylvester Hughes. Big up yourself, my cousin. I love you, my cousin. Thank you for joining Unscripted. Anything goes. Hortense Archer. Big up yourself, Hortense. Yeah, man. Yes, Rasta. No, go church. Yes, Rasta. Big up yourself, Hortense Archer. Yeah, man. Good evening. Yeah, man. Good evening. Yeah, man, straight up. Today, you go church today? Yeah, thanks. No church. Yeah, some people traditionally, the God church people that go to church on Saturday. Yeah, there's Sabbath keepers. What you call it now? Sabbath 7 day Adventists. Yeah, they go to churches on Saturdays. Yes, they do. Yeah, man. Some of them go to churches. Yeah, for those who are Sabbath keepers. Yeah. And when I was living in Jamaica, my neighbors, they were Sabbath keepers. So every day, you see them going to church, dress up in their Sunday clothes, and they head out to church. And when they're Sabbath keepers now, their church go on all day. Sabbath keepers, their church go on all day. They go on all day. Yeah, I don't know why. But I think they fast from sundown Friday to sundown Friday to sundown Saturday. Yeah. Yeah, man. Them fast from sundown Friday to sundown Sunday. No, sundown Friday to sundown Saturday. They deprive themselves of food. Mm. Yeah, they deprive themselves of food. Yeah. And then after that, they eat. Yeah, then full up them belly. Yeah, man, that is the God church people on Saturday. Yes, Sabbath keepers. Yeah, man, I went to church. Yeah, man, you went to church today, my brother. Straight up. You preach? Were you the preacher man today? You preach today? Yeah, man, the lovely Donna Marie. Paul John, thanks for joining. Unscripted, anything goes. Yeah, man, I love you, girl. Thanks for joining. Yeah, did you preach today, Artens? Yeah. One of my friend, Bishop Charles Richards. Sometimes he comes into this room. Yeah, he's a Sabbath man. He's at God church. He's a bishop. So he preaches on Saturdays. And sometimes yes, because it's sun to sunset. Yeah. So what he does, he preaches on Saturdays, and he broadcasts his thing on the internet. His show, Bishop Charles Richards. You can check out him show him as a God church bishop man on a Saturday. It's a God man. So yeah, so he pastors a church, a bishop a church, or whatever you want to call it. And he preaches on the internet on Saturdays. Yeah, so whenever he put them up, I'll watch his sermons. Delvin watch him sermon too, Yeah, Delvin watch him too. Even though I'm not a believer in the God church thing. But I watch it because you need a broad-based knowledge of what's out there. You know, you need a broad base, and not only that, you're supporting him as well. You know, straight up. So I watch a sermon. I watch it. Come home and I sit down and I watch it. Sit down and I watch it. With an analytical mind. But he's pretty good though. He's pretty good. Very articulated guy, Bishop Charles Richards. Yeah, man, check him out. Yeah, man, on Saturdays. Add him as a friend and check out his church. No, I'm not. Oh, you're not a preacher. Okay. All right. That's all right. Yeah, man. Yeah, you don't have to be a God church preacher, man. You can just go and sit in the pews in the church as well and take in the knowledge. Yeah, take in the knowledge. If you share that knowledge with somebody else, then you're actually preaching. Yeah. So you don't necessarily have to be preaching in front of a congregation to be preaching. Yeah. If you share the knowledge that you learn based upon reading or based upon what you've learned in the God church, and you actually pass on that knowledge to somebody else, then you are actually, yeah, man, you're actually preaching. Yeah, man, you are a teacher. Delvin is a teacher. Yeah. You know what, this lady, I haven't heard from her in a long time. I haven't heard from her in a very long time. And I see her sent me a message. A long message. And she said, Delvin. Yeah, a long message, Said, Delvin, I saw your videos. And I watched them. And I did not know you could articulate yourself that well. She said, you're in the wrong profession. She says, go to teachers college because, yeah, yeah. That is your true calling in life, is to teach. That's what she told me. She said, we have a nice message, So I tell her, thank you. But I enjoy my job. I enjoy my job. Yeah, man, I enjoy what I do right now. The work that I do, I enjoy it. I'm not leaving it for nothing. You know what I mean? I'm not leaving it for nothing, But in this setting here, I will do it. And if somebody invite me at a function to actually bring forth a lecture, then I'll do that. Yeah. But I think I got the great concept. Because in my family, there's mostly teachers in my families. In my family. Mostly teachers. A lot of teachers. Yeah. Yeah. My mom, sister, all of her kids are teachers. Every single one of them. Her sister that died, she was a teacher. Tons of awards for teaching in Jamaica. And all of her kids, teachers. Yeah, all of them taught at some point in life. They all taught. So genes, yeah, man, genes, teaching run rampant. Yeah, man, teaching run rampant. Yeah, man, the beautiful Jeannie Dorset. I love you, girl. Yeah, man. Delvin Goodman, I love you. Thanks for joining. Unscripted, anything goes. Yeah, man, beautiful people, Yeah, but I love doing the show. You believe I know how Delvin love doing the show. Yeah, the mere fact that I'm seeing myself on this device. Yeah, man. The mere fact, that is just enough motivation for me to continue doing the show. The World Wide Web is seeing me. Everybody out in internet world have access to see me. Yeah, man, just to be looking at myself. I love it. I love to be on the camera. Yeah, man. And not only that, I love to share my opinions with others. Yeah, man, straight up. We can disagree, but I love to share my opinions. Yeah, man. Yeah, man, straight up. Yeah, man. And just to motivate people to come out of their comfort zone, to explore their talents in life, I'm happy to do that. God, this is my talent. And I love it. Oh God, you do know I love it. Yeah, man. Big up yourself on Thea. I love you, girl. Thanks for joining Unscripted Anything Goes. The lovely Carol Clementson. Thanks for joining Unscripted Anything Goes. My brother Paul Johnson. I love you, my brother. Thanks for joining Unscripted Anything Goes. The beautiful, the lovely, the sexy Asheen. Oh, girl, thanks for joining Unscripted Anything Goes. Girl, you're hotting up the net. You're blowing up the net. Yeah, man. Yeah, man. Delvin, see a picture of them. Yeah, man. Bad. Yeah, man. Herbalist checking in. Somali. Yes, checking in, Herbalist Somali. Yeah, man. So, yeah, man. Straight up, straight up. All right, let me say something, though. Carol Clementson. I love you, Carol Clementson. All right, Carol Clementson watching you from yeah, yeah, catch it. Yeah, man. Evening, everyone. Yeah, man. Yeah, man. You're watching me. Yeah, man. Yeah, man. Claret Clemson. Loyal support. Let's see what the lovely and beautiful Donna has to say. Delvin, love you. Delvin, do you realize that I just dropped my my one message and go to sleep? Love your motivation. Big up yourself. Yeah, man. Yeah, man. You are a star. Yeah, all right, all right. Yeah, man. Yeah, man. Yeah, man. Yeah, yeah, yeah. Yeah, man. Big up yourself, girl. I love you, man. I love you. Yeah, man. I love you. Yeah, man. Delvin, love this camera device here. So you can see me, and I know you can see me. Oh God, I'm just looking at myself, and I am amazed. Yeah, man, yeah, man. The mere fact that all of you are looking at me, oh God, I'm shining bright. Yeah, man, yeah, man. I am full of confidence. Yeah, man. Believe in myself. Yeah, man. I am all that and more. Yeah, man. There's nothing that I am not capable of doing. Nothing. Anything I want to do, I do it. Yes, that's that. Nothing prevents me or will stop me from doing it. Yeah, man. And I will be a success on the show. And you are going to make me a star. All of you looking, you're going to make me a star. You don't believe it? Yeah, man, you'll see in time. You are going to make Delvin a star. The whole world is going to see me. I am going to tour every country in the world and deliver a message of love. Yeah, man, deliver a message of love. And I will be representing all of you because you're going to take me there. Yeah, man. Big up on yourself, people. Another episode of Unscripted. You see it. Anything goes. Delvin and his unique style. Yeah, man. Tonight we're talking about that thing. Yeah, the marijuana. Yeah, man. 2 nights ago. Oh, yesterday I went to see my mom's. So if you guys were looking for a show yesterday, you didn't see a show because I told you guys the night before that I was going to see my mom. I was long overdue in seeing my mom, so I went to see my mom, and she was happy to see me. Yeah, man. So the night before yesterday, we spoke about what do you think called? Yeah, the risk. Yeah, man, the risk of smoking marijuana. Yeah, man. So if you didn't see that show goes hand in hand with tonight's show. So tonight we're gonna talk about the medical benefits of marijuana. Yeah, man. Thea and I are gonna actually talk about that tonight. Yeah, man, the weed. Auntie, are you ready? Let me see if Auntie are ready. Yeah, man, let's see if Auntie are ready. Yeah, but we don't need lecture tonight. Yeah, man, I can just drop in one and two things. Nice, candid discussion. Wait there. You did it. You did it. I want to go over that here. Okay, flip back. See there? Yeah, man. Yeah, but where's Anthea? Let's see if Anthea is gonna come on. The beautiful, the lovely Anthea. Yeah, man. You guys haven't seen Anthea in a while, but you're going to see her tonight. That's star Anthea. Yeah, man. The lovely and beautiful Anthea. Yeah, man. Straight up. The beautiful, the lovely Anthea. Let's see if Anthea accepts that. And if she does, then we go straight into the show. If she's not ready yet, then Delvin can start. Okay? But while on there, get ready. All right. While on there, get ready. Let's put out this information that I'm gonna come from is from the lifehack.org. 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 So you can check them out. All right. So let's put out a disclaimer here. You know, this show is solely based on the benefit of medical marijuana, ganja, if you want to call it, pot, weed, blunt, whatever you want to call it. It's solely for the benefit of medical marijuana for those with valid medical prescription. That means you've gone to a medical doctor. All right, no problem on here. You've gone to a medical marijuana doctor, and they, based upon the symptoms that you exhibit, they give you a specific strain of the marijuana now, for medical purposes, right? Yeah, man, straight up. So we're going to highlight tonight the positive aspect only, because we already dealt with the risk and the negative aspect of marijuana. So tonight we're going to deal with the positive aspect, and this is based on researches and scientific evidence. All right, yo, please note that we don't the site here that I got this from and myself here don't promote the recreational use of marijuana. You understand, people? I don't suggest anyone smoke marijuana recreationally. That means, yeah, man, don't smoke it because you want to get high. No, do not smoke it because you feel it's something that is going to make you mellow and feel good. Yeah, you love to smoke marijuana. Don't smoke it for that purpose. Smoke it because it's medicinal and it has been authorized by a practitioner. Yeah, for you to smoke it based upon your medical condition. Aside from that, Delvin don't endorse it, nor does Lifehack.org endorse that as well. So that's the disclaimer tonight, because we dealt with the risk the other night. So we didn't need a disclaimer at that time because we're telling you don't do it. Yeah. So tonight we're going to tell you the medical benefits of medical marijuana. Straight up. Yeah, man, straight up, people. So if you're in the room and you are interested in using medical marijuana, yeah, here's what you need to know tonight. So from 1850 to 1930, cannabis, that is another name for marijuana or weed, yep, started to grow famous for recreational purposes. At the intake of this drug, as the intake of this drug increased, yeah, man, the Substance Act 1970 classified it as a drug. So straight up, as people start to use it more, it was classified as a drug. So naturally, controversies arose surrounding the use of medical marijuana. So that's a controversy. A big controversy started around that. So to make it more medical friendly, yeah, active ingredient THC was synthesized. Yeah, it became synthetic in 1966, and finally approved by the USA, the Drug Administration, in 1985. The synthetic aspect of the marijuana, no, based upon the THC level, different levels and quantity of it, is now approved by the Food and Drug Administration, 1985. Yeah, man, that is in America. Yeah, man, Antoinette Roach. How you doing, girl? Thanks for joining Unscripted Anything Goes. First Lady Daisy, thanks for joining Unscripted Anything Goes. I love you, girls. Thanks for joining. Yeah, man. In 1999, the U.S. government sponsored a study by the Institute of Medicine to uncover the benefit properties of medical marijuana for certain medical conditions, such as nausea caused by chemotherapy or wasting of or the cause for HIV. Since 1999, a number of studies have been done to show that to, to show that smoke marijuana as a pain reduces the effect of these illnesses. Straight up. Yeah, man. Good evening, Daisy. So they actually did a study on the marijuana in 1999. They a full study where HIV is concerned or nauseated stage concerned based upon chemotherapy. Yeah. They did a number of study, and based upon these study, the pain that is associated with these now has reduced based upon the consumption of marijuana, medical marijuana. In 1996, California became the first state to legalize the use of medical marijuana. Yep, California, drug country, weed country. Yeah, man, yeah, man. California, it must be a liberal state that did it. Yeah, man. Yeah, man. 1996, California became the first state to legalize the use of marijuana for medical purposes. And about 24 states now have some sort of marijuana legalization, you know? Yeah. In Canada here, they want to know legalize marijuana here for both medical purposes and also for recreational purposes here in Canada. By the end of this month, it's supposed to done. They want to turn the place in a high nation. Yeah, man, yeah, man, yeah, man. So you will be surprised to know why studies have been done on this herb. Yeah, man, there's a lot of money to be gained from the studies, but they have to make sure that it is safe based upon your medical needs for this drug. So they have to do these studies. But marijuana business people, big business, big business, big business. Yeah, man. Yeah, man. 28 additional states, 24 additional states in the United States, in addition to California, make 25 legal to sell drugs, legal to sell marijuana, herb. Yeah, man, straight up. Yeah, man, late as usual, but still trying my best to be here. Yeah, man, yeah, man, yeah, man, Delvin know that already, First Lady. Yeah, man, due to the job. Yeah, man, yeah, man, yeah, man, yeah, man, we know that. Respect due to Alan. Yeah, man, all of those countries over there, you can just go into a marijuana bar and just burn weed. Holland. Yeah, man, you have to. Holland, yeah, man, that's the Netherlands. Yeah, you can just go over there and burn weed. Sit down on the corner, burn weed. Yeah, it's a weed up place, them place there. Yeah, a weed fest. Yeah, man, if you just want burn weed, just go and get high. Weed up yourself. Not Delvin. Not Delvin. No, no weed for me. Yeah, straight up. I am naturally high. I am the vagina. I am vagina high. Yeah, man, vagina high. No marijuana high for me, or explicit drugs, or alcohol. I am naturally high. Vagina high. That's what we know. I'm vagina high. Yeah, man. Yeah, man. Delvin is vagina high. Yeah, I don't need any weed to be high. I'm vagina high. Yeah, man. Europe is my place. Oh, yeah, man. Big up yourself, my brother Matthew Jameson. Thanks for joining Unscripted. Anything goes. Yeah, man. So marijuana slows and stop cancer cells from spreading. So marijuana, yeah, the first one we're gonna touch on is cancer cell. So marijuana slows and stop cancer cells from spreading based upon the studies. Yeah. Big up yourself, my cousin Kenrick Hughes. Big up yourself, my brother. I love you, my cousin. Thanks for joining Unscripted. Anything goes. It was found in a study published in the Journal of Molecule Cancer Therapeutic that Cannabizoid has the ability to stop cancer by turning off the genes called, um, as per the research from California Pacific Center in San Francisco, reported it stops the cancer cells from spreading straight up. So according to them, yeah, it can actually stop the cancer spread from spreading. As you know, cancer comes in two forms. You have the benign, which is actually, it is just it stays in a particular area and it does not spread. That is called benign. Okay, and in most cases, yeah, you can either actually use the chemotherapy or radiation to actually shrink or reduce it or get rid of it, or it just stays there and don't move. That's when it's benign. On the other hand, when it's malignant, right, that is where now the cell itself start to replicate itself. It starts spreading, so it starts to moving all across the body. Yeah, and this is where chemotherapy now is tried or used to now kill the cancer or to rid the body of the cancer straight up. But in this case, they're saying marijuana can actually now stop the cells from spreading. So even though it's malignant, even though it's malignant, yeah, it can also help marijuana from stopping the cells from spreading. Yeah, man. Big up yourself at Skull. Yeah, man. Thanks for joining Unscripted. Anything goes. Big up yourself, Beverly Bellamy. Beverly Bellamy. Big up yourself, Anna Chang. I love you, girl. Thanks for joining Unscripted. Anything goes. Straight up. The Raquel Stars. The beautiful, the lovely Raquel Stars. Thanks for joining Unscripted. Anything goes. Yeah, man. Hello again. Oh, you have internet tonight. Yeah, yeah, yeah. Yeah, man. You have internet tonight. I'm home now. Hey, okay, no problem. I love you, girl. Thanks for joining. Unscripted. Anything goes. The researchers experimented on breast cancer cells in the lab that had high levels of TD minus one and treated them with cannabis. Yeah, so they've treated in the lab people with breast cancer with cannabis, um, with marijuana. Yeah, the outcome was rather positive according to the researchers. The cell had decrease, yeah, decrease minus one expression and were less aggressively spreaders. That means, it wasn't spreading as rapidly as before after the consumption of marijuana. In fact, the American Association for Cancer Research found that marijuana actually works to slow down the tumor growth in the brain, yeah, breast and lung considerably. So if you have brain cancer or you have breast cancer or lung cancer, cancer of the lungs, yeah, the consumption of marijuana prescription, yeah, can actually help to actually slow down the progression of the malignant cancer cells considerably. Yeah, man, straight up, marijuana can help you. This is according to the research. Yeah, Delvin, let's not telling you now to go and smoke weed. No. Remember, we did put out the disclaimer earlier. Go and see a doctor. Let them prescribe it to you. Yeah. Yeah, man, hello. I have internet tonight. All right, straight up, girl. Yeah, man. Straight up. Marijuana, states here, can also prevent Alzheimer's. All right? It can prevent Alzheimer's. Yeah, man. Straight up. Yeah. It can present Alzheimer's. Straight up. Mm-hmm. So for those people that have problems, in their older age, and the deterioration of the brain cells, and they don't remember anything or know who you are, they're just living. Yeah, this can actually help prevent Alzheimer. Yeah, man. Yeah. You come see me, yeah, man, all the time, girl. I love you. Yeah. So straight up. Mm. Yeah, man. Straight up. So it says here, the THC in the marijuana. Yeah, man. You're coming on. You're coming on. Okay, all right. Yeah. All right. I'll send you the link in a minute. Let me finish this Alzheimer one, and then I put you on. All right. THC, the active ingredients present in the marijuana, slow the progression of Alzheimer's diseases. Straight up, the Alzheimer's disease. A 2006 study led by Kim Janda of the Scripps Research Institute found THC slows the formation of amyloid plaques by blocking the enzymes in the brain that makes them. So the enzymes in the brain that now clogs up the brain. Yeah, that clogs up the brain. The plaque, just like it is on the teeth, or you say you know them plaque up your teeth, it block up these areas. Yeah, and it actually start to decay the teeth and destroy the bone muscles here. It's the same kind of process in the brain. Yeah, where plaque is formed on the brain that clogs up the blood vessels and the cells there, blocks it up. And that is why people now lose memories because the blood cannot circulate properly through the brain cells and they now become, yeah, they can't remember things. They become hallucinates and all of these things. So what it's saying here is that yeah, the THC slows down the blockage of plaque, yeah, on the brain. So as a result, yeah, the marijuana can actually help to actually reduce and prevent Alzheimer's. So these plaque kills the brain cells and potentially leads to Alzheimer's disease. So what the marijuana helps is to actually slows down plaque from growing on the brain cells or prevents it. Yeah, man, straight up. All right, let's bring in Anthea. Yeah, man, the beautiful, the lovely Anthea. All right, we can find Anthea. We can find Anthea. Yeah, man. You know, Anthea have a lot of fans here, you know. Fans are missing. Oh, yeah. What happened, Anthea? Come on, Anthea. Where are you? Hey, Anthea. Yeah, man. Anthea, log out and log back in. You're gone. Let me see. Yeah, Anthea in the room. Yeah, man. Big up yourself, my brother, early. I didn't see you come in the room. Thanks for joining. Unscripted. Anything goes. I love you, my brother. Thanks for joining. Yeah, man. Straight up. Yeah, man. Straight. Marijuana. Yeah, man. Straight up. Marijuana. Potent kind of drug. I don't know smoking. I don't subscribe to the smoking of marijuana. No, because it can have a double whammy effect. One, it could be good, and one, it could be negative because the tar potency within it. Yeah, I don't see anything positive about smoking. Yeah. So you could be getting the benefit needed to help you. But over time now it can block up your lungs and block up your brain and cause this callus on there which now shrink your brain and actually cause respiratory problem on the lung. So I don't subscribe to it. If you're going to partake in the marijuana, in my opinion, it's best to actually get the extract, vaporize it, or actually eat it. That is what I would think. Yeah. Um, Miss Forget Thomas. And people say me smoke too much, but it helped me to forget people. Yeah, it helps you to forget people. Calms you down and take away your pain of the problems that people cause you. So it's a sedative for you. Yeah, man, straight up. So marijuana also treats glaucoma. It also treats glaucoma. Yeah, man. Yeah, man. Big up yourself, my brother Jason. Thanks for joining. Unscripted. Anything goes. I love you, my brother. Thanks for joining. So marijuana can be used to treat glaucoma, which increase the pressure of the eyeball, yeah, injuring the optic nerve and causing loss of vision. So that's what glaucoma does. So it actually injures the nerve of the eyeball. In fact, my daughter had glaucoma. Yeah, so it damaged the you see that black thing in the eye? That black thing is actually your lens. All right. So what glaucoma does, especially for people that has diabetes, yeah, type 1 diabetes, it attacks the sugar, attacks the eye and the glaucoma now. It destroys it the black part of the eye, which is a lens. It destroys that and impede your vision. Yeah. So it can get so severe that it destroyed the front and the back of the lens. But that can be repaired by taking out the lens and putting an artificial lens. Yeah. So what marijuana does is that it can actually treat glaucoma. Yeah, treat glaucoma, not get rid of it, but actually to help reduce the damage done to the lens as a result of having glaucoma. It says, according to the National Eye Institute, marijuana lowers the pressure in the eyes. Yeah, study in the 1970s show that marijuana, when smoked, lowers intraocular intraocular in people with normal pressure and with those that have glaucoma. The effect of the drugs can actually prevent blindness. So if you have a mild effect of the glaucoma, the marijuana can now actually take out the pressure from the eyes and cause you to see, but it can't actually cure the glaucoma, but it can actually reduce the effect of it so that you're able to actually have a good vision. You never read my stuff, right? All right. Type it again then. Raquel, type it again. Type it again. Type it again. No problem, girl. I love you. Thanks for joining. Type it again. Yeah. The marijuana can actually relieves arthritis. Yeah. Remember, people, Delvin is not advocating for marijuana smoking. This is the medical aspect of it, where a medical practitioner, a licensed practitioner, must actually prescribe it to you. Yeah, before you even indulge into it. Yeah, the THC level is very potent in some of it, right? So they have different grades of THC in the marijuana because it's synthetic. So therefore, they make it as potent as possible, and then they reduce the potency level in them. That's why there's different grading of it, and the medical practitioner will know, based upon your medical condition, the potency that is required to actually help you in your illness. So first, make sure you go and see a medical practitioner if you're going to use medical marijuana. Don't just smoke it on your own. Yeah, don't just smoke it on your own, please. Delvin never smoking in my life. No, never. Please. So I'm not an advocate for smoking. Yeah, man, I'm not an advocate for that. Yeah, man. You never, then type it again, please. Type it for me, please, again. Type it again. Yeah. So marijuana relieves arthritis. Okay? It relieves arthritis. In 2011, researchers reported that the cannabis reduces pain and inflammation and promotes sleep. Yeah, which may help relieve pain and discomfort from rheumatoid arthritis. Yeah, man, research of the rheumatoid unit at several hospitals gave their patients sedative, Sativex, cannabis-based pain-relieving medicine. After 2 weeks, the patient of Sativex had a significant reduction in pain. Yeah, and improve better sleep quality compared to previous use. without it. Yeah. So this is actually being given in hospitals to actually help. Yeah, pills with marijuana in it. Yeah, but it's actually given to patients with rheumatoid arthritis, and it helps to relieve the pain. Mm-hmm. Big up yourself, First Lady D-Man. Thanks for joining Unscripted. Anything goes. Puff puff pass. What you say? You puff puff pass. Yeah, man, you puff puff pass, girl. Yeah, man, you puff puff pass. Yeah, you puff puff pass. Yeah, man, straight up. Like one of my friend, I went to visit him in New York, right? I went to visit him in New York, and his cousin came to visit us while we were there, and his cousin, and a Yankee guy was there, right? Like gave him some marijuana to make it into the blunt. When he made the blunt, now he started to smoke the marijuana. So he started to smoke the marijuana, and the guy who gave his marijuana now, like stepped away for a little bit. So while he was gone, because this person is from Jamaica now, he thought that, if somebody give you some weed, it's for you alone. So he was actually smoking it by himself. And when he came now, and when the guy came back now and says, yeah, man, light up the blunt. Light up the blunt. Right, so light up the blunt. Man said, light up the blunt done already. Man said, you finished, you finished shit. You're supposed to puff pass. What's wrong with you? You're supposed to puff pass. You can't just smoke that for yourself, man. You know how expensive that shit is. we in New York, we puff pass, buddy. You don't do that, man. And he was pissed off. He was pissed off. Yeah, man, he was pissed off. But he got over it, Yeah, man, he said, you don't do that. You don't smoke a blunt by yourself. You're supposed to puff, and you pass. That means you take 2 pulls of it, and then you pass it to somebody else. Mm-hmm. Yeah, man, that's how they do it over in New York there, But each from Jamaica know that you light up your own spliff yourself. Yeah, you light up, you smoke that yourself. But puff, pass. And they actually mix it with all kind of nonsense like cigarettes and tobaccos and all of that thing. Even just smoke it straight. Yeah. Yeah, man, straight up. Yeah, man. Mm, I have a message to get full Thomas. And people say me smoke too much. And people say me smoke too much. But the herb I help forget. About the herb I help forget full people. Oh, I see what you mean. Yeah. Yeah, man, yeah. I'm miss forgetful. Yeah, that's what you want to say. Yeah. I'm miss forgetful, Thomas. I get it now. So you forget things. And people say I smoke too much. Yes, people are saying you smoke too much. But the herb help, yeah, man, forgetful people. So what she's saying is that if you're one of those people that tends to forget a lot, for her, yeah, what she finds is that the herb actually helps her to remember. Yeah, the herb helps her to remember. That's what she said. That's her experience with it. So in her kids, based upon her illness is actually cannot to forget things. But when she partakes in it, yeah, the medicine, the medicine. When she partake in the medicine of cannabisoid, yeah, it actually helps her to remember. Yeah, people. Yep, that is what works for her. Yeah, that is what her doctor prescribed for her. Yeah, man. Mm. Yeah, man. That is what her doctor prescribed for her. Yeah, she might be her own doctor, but that is what her doctor provide for her. I would have been so I would have been so mad. Yeah, you would have been, but calm me down. Yeah, I know yours. You're mad. Okay, let's continue. Foolishness, herb street. Yeah, yeah. You see, yeah, yes. There you go. Yeah, man. Me get it, man. Me get it. Yeah, 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 yeah. If you just line by line it, yeah. You say it. Yeah, man. Yeah, man. Anime. Yeah. I might get. Yeah, man. I might get on the show. Yeah, man. Come on the show, man. You want me send you a link? I send you a link and see if you accept it. Come on the show. May have a little dialogue about the herb. Have a little dialogue about the herb. Yeah, man. Accept that. Let's talk about the herb. We're going to talk about the herb with Miss Stars, the beautiful Raquel Stars. We're going to talk about the
Major,
herb.
major, Delvin.
Yes. How you doing, Raquel? Thanks for joining Unscripted Anything Goes.
Good
Ladies
night.
and gentlemen, tonight's guests, the
No.
lovely, the talented, the beautiful. As you see her, you see me. Raquel Stars.
Good night.
Stars. Yes.
You said it, not me. You said the doctors said it
Mm.
helps people with Alzheimer's, right?
Yes, it does.
But
Yes.
that's people that forget stuff. And if me just smoke it naturally and them I say me I forget full Thomas, like I'm gonna get it. That's what I said. That's what I was trying to say on there.
Okay, okay. So for you, then, when you smoke it, you forget things. Then.
I just forget stuff naturally. It's not the
Yeah,
smoke. So that's what
yeah.
man says. So how comes it's helping people that's forgetting stuff? You know
Because what
the
happens is that,
saying, the Jamaican saying what I'm
yeah.
saying. Oh, you have miss forgetful Thomas because you probably don't remember what them want you to remember.
No, but in this case, with the people that has the Alzheimer's, it's a genuine medical condition.
That's what I'm saying. If
Yeah.
I naturally just forget stuff, cause whether I'm a smoker or not, I'm just forget
Mm-hmm.
stuff according to people. And
Well,
I
the
smoke.
source of you not remembering might not be
That's
Alzheimer's.
it's
It's
not that
two
I was
different things.
sarcastic. That's what I'm saying. I'm
Yeah,
not that.
yeah.
So if medically it's helping people that lost their memory or then
Mm-hmm.
obviously it's good. It's just an old time saying what the music Jamaica say. I want to miss forgetful Thomas.
Yeah, yeah, me
Oh,
know, me
okay.
know, me know, me know.
Yeah. I
So,
like your
so
program.
yeah, man, it good, man. So you enjoy the marijuana, the cannabis, the ganja, the weed. You
Yeah,
enjoy it.
just more relax. That's it.
It calms you down.
Yeah.
So you are a person that have anxiety problem then,
Somewhat, I think.
or sometimes you're hot-headed.
No. I like to relax. I just use it to relax and watch
So
TV.
so you can't relax without it.
I can. But it's just like my company to me. Instead of being all over and a talk or gossip or whatever, I'd rather just smoke and chill, you know?
Walla vibes, walla vibes.
Yeah, yeah, that's me well in a vibes.
So when you smoke it now, it makes you like it put you into a zombie like state then.
No, not zombie. I would say, could you go to your room?
Go on, leave her alone, man. Leave her alone, man. She not doing nothing. That's fine.
Mona say zombie thing. Mona say zombie
Yeah.
thing.
Yeah.
I
So you
just
are
smoke,
you are
relax,
naturally
and watch, and then go to bed.
yeah. So all right, let me ask you then. It make you feel high?
Yeah, relax if that's what them call high. I'm just
It
relaxed.
make you
It's like
feel
a mellow feeling. Just feel nice and
a mellow
mellow.
thing. Not a care in
Yeah,
the
it's just
world.
more
Nobody's
like
bothering you.
to me, like tune. It's like you tune people out. It just tune people out, and you
Yeah.
focus on whatever it is you're trying to focus on. For me,
Uh, uh-huh. Does it slow you down?
yeah.
It slow you down.
You keep on. I try to put words in my mouth. It don't slow me down. I'm relax. Just
It
I'm
don't slow you
relax.
down. No, what I want to get at here, what I'm trying to get at is would you be able to operate a vehicle safely
Still
when you
normal.
move?
Yeah. still normal. Everything's still normal and everything. That's what I said. To me, it just helped me focus. To me, like I'm more focused on this, and that's what I don't want to know nothing for like this trap me then, you know.
Uh-huh. Okay. All right. Yeah, man. Nice sharing your thoughts there. It's good, good things. Anything you want to
Well,
say
that's
to the people them tonight?
any
Anything you
little
want to
pain.
say to the people?
Smoke some herb.
What's that?
Any little pain in my field, smoke some herb. It's really good.
Oh, okay. Okay.
Yeah, once
So how
I
do you know how
let me,
much how do you know how much you're supposed to smoke anyways?
I don't know, I'm just smoke all day, every day. Once I have nothing for them, just smoke.
Did you just say all day, every day?
Yeah, like if I'm at work, I don't smoke. If I forgot work, I don't smoke. But once I come home, I have to smoke.
You have your smoke.
Yeah.
Yeah, man. You always want to be mellow.
Yeah, I'm just like that feeling.
Yeah, mellow. Like me personally, I get eye, but I get eye on the vagina. That is what give me my
That's a
eye.
man thing.
Huh?
That's a man thing, I think.
Oh, all men get like that?
Probably. I mean,
No,
vagina,
but
that's what every man think
I
about.
love that
In
high
a gay,
though.
that's all they think about.
I can be on that high all day, every day.
Mm. Okay.
It's a
You can be
nice
on that high. I'll be on my smoking high. Mellow, smoke, chill,
mellow
relax.
high.
Tune the world
Yeah,
out with the foolishness. Yeah.
yeah,
Tune
yeah,
them
yeah, yeah,
out.
yeah. Yeah.
Yeah. But this I'm gonna get right. Like medically, I think once it's like all natural and you don't mix it, then it should be good. You can
Yeah.
tell if it's good or not when you smoke it because if it's garbage, you ain't gonna get high. You gonna still feel the same goddamn way before you even smoke it. So you know it's garbage. But once you feel that nice, like a high, like a mellow, the same like if you
Yeah.
would take a pill. That's why you know pill are drugs. All them pills
Yeah.
and medicine are drugs because you feel way different when you take pills or medicine. You feel like that's why I'm telling you don't drive or be comfortable or whatever because you literally feel light. That's why I'm gonna take pills. I'm gonna drink medicine. I rather smoke
Mm-hmm.
for whatever. My back hurt, I'm smoke. My head hurt, I'm smoke. I drink some tea.
So for you then, when you're feeling pain, that works
Real good and real fast.
real fast, eh?
Yeah,
Yeah.
real good and real fast.
Because what them say is that the
You're
THC
free.
in it now, it because you're smoking it, it goes straight to the brain right away and have the medical effect to it. Yeah. So that's why the pain actually go away
Because
right away.
I say even okay, with my daughter when I was pregnant with my daughter, like, I get sick every day, like literally sick every day. I can't eat, I can't drink, I can't do nothing. I'm gonna do a throw up, and I get dehydrated. I forget them have to admit me at the hospital for because I'm so dehydrated. And the
Yeah.
only thing that could help me relax and keep something down was smoking a spliff.
Oh yes.
No, seriously,
Yeah.
it was the only thing that could help me. And the pill, what them that tell me for forget, it was like two something. You only get 4 pills, so
Mm.
I'm like throwing up every day, all day. I know I give me 4 pills for two something.
Wow.
We can't afford
Mm.
that.
Yeah, that is true.
We can't afford
Well,
that, and it
so
never
what's
worked. I'm gonna take it 10 minutes more good by half an hour. I'm gonna start throw up again. I want to smoke. It will work for hours. I'm gonna never have to smoke a lot. I'm just have to take 2 puffs, 4 the most, and it lasts
oh,
for like hours.
wow. So
Yeah,
what state you live in? What state you live in?
Philly.
Philadelphia. Is that legal there?
I don't know.
So you don't go into a store to purchase it then?
No, I don't.
Yeah. All
At all.
right. Yeah.
I come from Philly. I'm in Jamaica.
Oh, you get the real thing.
You put words in my mouth.
Yeah, yeah. And I'm just saying, like, like you don't get the synthetic one. You just get the real.
That's what I'm gonna understand with people. How can you like smoke the synthetic stuff that they make instead of the regular stuff, the natural stuff that grow out of the
Yeah.
earth? Like, get it? Oh, something that grow out of the earth is considered drugs.
Mm.
I
Yeah,
can't get
because the
that's just
syn well, that is how they control now the content of the THC in it, as to how potent
chosen,
it
right?
would be.
You
So in that sense,
on one
they
thing.
what's that?
You just stuck on one thing.
My stuck?
Yeah.
My still stuck?
Yeah.
Well, make it stay the stuck. Anyways. Yeah, so what happened is that, yeah, what am I saying is that when they make it synthetic, they can control the amount of THC that is in it. So then, based upon what you need, the THC level, then they can actually give you that rather than to like use a high potent one like high grade as you would know it as that have too much THC in it that can do damage to you instead of doing good to you. So have you ever smoked like a weed that
But
you
it's
said this is too
good.
strong for me?
How them know it's too much, it's too potent. How do they define all this potency? Like I'm gonna get it. How them know all of this?
Because they study it. They study it based upon the kind of illness that you have. You
Them study some
understand?
way, but them make
Yeah, yeah, man. Them study what they make it. They study it.
but
They study it.
them
Like
know
and
as them give people all of these goddamn diseases. Like I'm say, them get them all
yeah.
of this disease, and then them know how to control the disease.
Let me explain to you then. Look on you now. All right. If you smoke like a high potent, high grade weed, right?
You know what make you do? Go sleep.
It make you go sleep, right? So maybe that is just too much. Maybe that is just too much. So say boy,
Oh,
if
so you
you're
know, so when that happen, you know you do. You know forget some little foolishness because you have the real good stuff. So you get some little regular old dry out push, but it's
yeah,
not.
yeah.
And you add a little itty bitty bit. Like everybody know this.
Oh, that's how you do it, eh?
Yeah,
Okay.
do it so you know
Yeah,
next time you're not eat yet. You're gonna just eat everything inside. Simple.
yeah,
You only
yeah.
that's it. If you in a pain, it just relax you. It ease the pain. You go sleep. That's it.
Right. So that's the same process to which they use now to actually breed them like synthetically.
But
So
that's
so
me.
the
Too.
dry out one now, yeah, the dry out one probably just for newbies, people who are you just a try it pan, who never smoked before, but they are trying out the substance for the first time. You have a mild headache, you don't have severe, then they give you the dry out one like you talk about. If you have like migraine now, very, very high migraines, then they give you the big thing where you talk about, high grade. Mm.
Like,
Yeah.
because look, okay, when you take pills, if it's not a certain amount of milligrams, it don't work. No work. Don't do nothing.
Yeah.
And that's drugs. Well, if I then mix it with and make it with all that crap, like, you can't make weed. How you make weed?
Well, it's based upon how much fertilizer they use and the soil that they use and
That's the only.
how much lighting they put on it and stuff, watering, a whole different way.
I used to eat dirt. I'm a crave dirt even being here, but when I eat the dirt over here,
No,
the soil not gonna kill you, not gonna kill you.
yeah, not kidding.
So I'm still in the see what am I say? Like I'm saying, it's natural. It's all natural. It's like callaloo.
Oh yeah,
They know you something. Same
uh-huh.
thing.
Yeah, man, yeah, man. So
Hey,
what else?
yeah, I grave.
Yeah, man, big up yourself, Andrea, by grave. So anyways, what else? All right, any other medical issues that you had that the weed helped you with, so that you can
Okay,
actually let the people.
when I have my daughter, them give me that epidural crap, that foolishness, mess my whole
Yeah.
up, mess my whole back up. No matter how much pills them give me, it don't work.
When you had when you take the epidural.
Yeah, after you get out, it
Yeah.
still affect you years down the line. It still affect you, and nothing
Okay.
works. Them pill work for me. Nothing
Mm-hmm.
work. But if I smoke a spliff, I'll be good. I'm gonna have to smoke the whole thing.
Okay. So you what happened? You have back problem, ear problem as a result of the epidural,
Yeah,
and
a lot
it's
of males will get the epidural will tell you that them have back problem.
okay. So that is it's severe pain then,
Yeah.
and all you deal with that is to smoke.
Huh?
The smoking of the marijuana actually get rid of the pain.
Yup. It release your
Yeah.
back because when your back starts stiff up,
Uh-huh.
if a split, it just relax your back and you can move. You can lie down. May I tell you, I think it's more like a muscle relaxer then, but
Okay.
without
Mhm.
that um, drug
The
effect.
eat.
You know?
Yeah, yeah, yeah. Uh-huh.
Yeah, that's what me that said it because I got an emergency room and the pills them give me don't work. It don't do nothing.
Natural.
Yeah, you just have
The
to
weed
smoke a
natural.
just once you know mix it and I mix it with no
Mm-hmm.
foolishness. I don't even mix it with
Mm-hmm.
cigarettes. Smoke cigarettes. I'm just smoke it straight. Might mix it with
Any other what you mix it with?
grabber.
Yeah, okay. Okay. Okay, all right. All right, all right. All right. Any other illness it help you with? Did it help you with like period cramps and all of these things?
Every I'm telling you, everything.
It works for that too.
Every
It works. Yeah.
everything.
Okay, okay. Everything else. You have to tell the people them specifically, so them know that you know what
That's what I'm
this
saying.
help you.
Crumbs, any type of crumbs, pea and anything. And some of them, um, let me leave that for some other time. But then remember
What
I
you mean
said
that?
government hide and smoke. They do hide and smoke.
I
Them,
just smoke.
them know it's good, it's natural, and it's better than medicine and pill. Them know.
Yeah.
Them just
All
take
right.
yeah,
Is that Jamaica shirt you have on, don't?
yeah.
All right. Let me ask you a question now. So a lot of people have actually fought for this drug over the years. Why is it that other countries are benefiting from marijuana legalization, but Jamaica, who has fought so hard for it, especially the Rastamen them now, they are not benefiting from this drug. Why is that?
That's a good question, but wrong person. Tell her the other day. Yeah, that's the only thing we can say.
Yeah,
Yeah,
yeah, yeah, yeah.
because we do
Because if
from
mhm,
your but they make it so hard. Again, many thing, like I said, it's just them take poor people for eat that. Simple.
for
Everything.
idiot,
That's what it come down to at the end of the day. That's all it come down to.
yeah, because Jamaica, could actually use this herb and actually get rid of all of their debts.
Yeah, I
You know,
think because when you said that the other day, I was like, that's a good point.
of course, most definitely, because if you are not actually partaking in the synthetic marijuana that they're selling over this side of the world, but you are actually going back to the real thing, that means
Listen,
there's a market out there for
I
that.
did know so them have synthetic weed. And this Yankee boy make me know this overnight.
Yeah.
And the boy there, if when him smoke that, the whole of our little island Jamaica could have whoop him ass from now till a morning. Him not feel not one lick. You hear me say?
Okay.
Him not feel not one lick. You think you could have do that to somebody where I would just smoke the regular natural stuff? Hell no, cause all them I think about either something to eat or go sleep. That's it.
So there's nothing like the real Jamaican thing then.
Not like the real deal. The real deal. Man, I said just straight from yard. I don't know where the hell them get them stuff from or. But I said
I was listening to a program on the
herb.
I was
Not
listening to a I was listening to a program on the radio, internet radio, and this white man he called into the program and tell them say they need to clean up the violence down there because he comes to Jamaica just to smoke the Jamaican herb
Mm-hmm.
because it's the best herb in the world.
Mm-hmm.
And if marijuana is being legalized across the world,
The world, why
why
not there?
why not Jamaica now legalize it there so that the farmers can actually now ex grow enough to export it abroad and tax
Yeah,
money
but
now comes
you know,
into the country.
yeah, it's crazy. I'm saying at the end of the day, them just
Yeah.
make it hard for
Um.
black people because even now in 2018, and people at Jamaica get locked up for a little tiny spliff. I hear people, little
Yeah.
young people that say them have to eat it because them see police are come and them have to name them spliff. Like that's foolishness.
Yeah. That's nonsense.
That's total foolishness. You gotta lock up a little young youth just for that.
Yeah.
It make no sense.
Yeah.
And I have bigger problem for the look about and do
Yeah.
and go investigate.
Mine, I went to Jamaica a few years back, and
Central Carissa, I'm from village, but I've been all over.
yeah, I went to Jamaica a few years back, and I went to pick up this girl, right? This girl that I met on the computer here, and she was gonna, we met to have sex, right?
Mm-hmm.
We met to have sex.
Happy?
Yeah. So I picked her up at the bus park. After I picked her up in the bus park, now I didn't know what is in her possession. So I made an illegal turn on the street. And when I made the illegal turn, the police, I didn't see the police, they came and pulled me over. When they pulled me over now, they went straight to her bag, opened her bag, and she had marijuana in the bag.
Yeah.
So yeah, she had marijuana in the bag. So I went straight to them and I said to them like, I did not. I wasn't aware she had it, and she never told me she had it. Okay, so I'm innocent of this all. And she went straight to them and said exactly what I told them. You understand? And they took the marijuana from her, and then they came back and said to me that in Jamaica it's a regular thing for people to have their personal possession of marijuana, and they wouldn't lock her up for it, but they are taking it for themselves. They're taking it.
That's
so
what
they
I
took it.
said.
So they let her off, which is
That's
a
what
good
I said.
thing. In
It's
that
a good
case, it's a good thing. So for those people who the police are locking them up now for a spliff, that is
but
just
different
outright
though.
nonsense.
She's a
Hmm?
female. It's a different.
Oh, she's a
Oh,
female.
in
Okay.
America, yeah, them have white privilege. See,
Hmm.
I think like Jamaica and other Caribbeans and like
Hmm.
other poor area all over the world. When you're a female, you will probably get out with certain little knick-knack, because you're a female. But when it's a man, especially when it's a black man, it's a problem.
Hmm.
Because I'm pretty sure if I did you our next man and them find a little split on him, them would lock him up. 8 times
Oh.
out of 10, lock him up.
Yeah, but I can't articulate myself out of them situation there. So, you know what I mean? Cause you have to give police respect, and I respect
You
police.
have to give them
So,
respect, yes, but them,
yeah.
you
So,
know, the
especially when
fault.
you know that are you a break the law, you have to give them respect. You have to
Break
know
the law, a
actually,
plant, a plant.
yeah. You can't actually deal with them like say, boy, them I do something wrong. It's you who actually did something wrong. Okay, let's see what Sterling has to say. McKaylee, um,
Michaela,
Michaela have to say. She says, it will never be decriminalized, yes, but they will keep it illegal to make money for the government.
exactly.
So what she's saying there, is that the government, the undercover industry, is actually they are the ones who's actually what do you call it now, having their monies in it.
Them,
So it
them it's a
wouldn't be
benefit, basically.
yeah. So the underground money and the actually sponsors of these illegal drug selling is actually their money. So if they make it legal now, then everybody has the right now to make money from it, and they wouldn't want people to actually make money from it. So that's what she's saying.
I know.
Hmm.
That's what
She
she.
says, um, Carissa says, your face look like someone she met before.
Mm-hmm. Where?
Yeah,
Mhm.
man, yeah,
Probably my
man.
have that familiar face because people tell me some move got Miami before, and I'm like, no, I was always here, and I'm always
Yeah,
seeing, always in my house, you know. So I'm probably have that
yeah.
familiar face.
She
People
probably
ask,
see you on the TV, you know. She probably see you
oh,
on the
I'm done. May I
TV.
come fast for your page? Cause I probably know you. You probably know me. I will probably met
You
before
never
or
know.
stuff. Yeah.
Yeah, man. Big up yourself, Valerie Williams. Big up yourself, Michael Clark. Big up yourself, Melissa Godson. Nadine Bernard. Thanks for joining Unscripted. Anything goes. Who am I missing? Carissa. Big up yourself, girl. Yeah, what's your name?
Michaela. Michaela.
Michaela. Big up yourself. Yeah, man. Big up yourself, Barbos. Big up yourself, my
All
brother.
right,
Thanks
I'm
for
gonna watch
joining.
it now and smoke my other
Yeah,
little
man.
spliff.
Shedrin went.
I and a smoke.
Children, what? Thanks for joining. Yeah, man. Big up yourself and
I
thanks for joining and
like
thanks for
it too.
sharing.
It's positive. I like it.
Yeah, man. Big up yourself,
All
man.
right.
Anytime, girl. Knows how to actually get the best result based upon trial and error over the years. But if you're just getting into it, don't try that. Yeah. Go and see somebody who is proficient in it. Yeah. Yeah, yeah, yeah. Yeah, man. Yeah, you can't say, but I'm from. Oh, you're from St. Mary. Mm-hmm. Yeah, man. Yeah, man. She's from St. Mary. So yeah, so it actually control epilepsy as well. According to them, marijuana actually control epilepsy. So a 2003 study showed that marijuana can actually control epileptic seizures. Straight up. Dr. Robert De Lorenzo, a Virginia Commonwealth University, yep, gave marijuana extract and synthetic marijuana to epilepsy rats. They gave it to epilepsy rats. The drug stopped the seizures in about 10 hours after taking it. It found out that the THC controls the seizure by binding the brain cells responsible for controlling the excitable and regulating relaxation. So yeah, so what happened is that now the brain cells that is responsible for the seizures, what the marijuana drug does is it binds it. That means it puts it in a vacuum and not allow it to be active. Hence, you can now don't have an epileptic seizure. So it makes you more relaxed and able to function normally without the seizures. So it help controls the seizure. And I was watching a show on marijuana and CNN, and there was this guy who has a lot of seizures, and you know, no medication could help him. And he went and he tried the marijuana, and he was getting seizures like every minute, every other minute. And after taking the marijuana, he didn't get the seizure, and he would stutter and he would go into this seizure like state. And after taking the marijuana, he didn't get it. So there, that based upon that, I can see that it works. Yeah. So according to the study here, where they tried it on rats, yeah, it helps. Yeah, it helps. Big up yourself, Dolores. Thanks for joining. Unscripted, anything goes. I love you, girl. I love you. Yeah, man. Marijuana also eases the pain of multiple sclerosis. Yeah, multiple sclerosis. If you have multiple sclerosis, and you get a lot of pain associated with it, this now helps eases the pain. So marijuana works to stop the negative neurological effect and muscle spasm caused by multiple sclerosis. A study published in the Canadian Medical Association suggests that marijuana may ease painful symptoms of multiple sclerosis. Yeah, man. Jody Corey Bloom studied 30 multiple sclerosis patients with painful contractions in their muscles. These patients didn't respond to other medication. So they tried other medication, it didn't work for them. But after they smoked marijuana for a few days, they reported that they were in less pain. Mhm. The THC in the drug bonds the receptors in the nerves and the muscles to relieve pain. Yeah, man. So it helps with multiple sclerosis. Big up yourself, my brother Andre. Thanks for joining Unscripted Anything Goes. It soothes tumor for people with Parkinson's disease. So people who have Parkinson's disease, those people that shakes, Yeah. So recent studies from Israel shows that smoking marijuana remarkably reduces pains and tumors and improves sleep for Parkinson disease patient. Yeah, man. Yeah, man. Even for asthma, you can boil it and drink it. Yeah, yeah, yeah. You see that? Yeah, man. See, Raquel Stars there. She's experiment with it for a whole lot of things, and she's telling you if you've got asthma, boil it and drink it. It will help. Yeah, man. Straight up. Marijuana. What was um what was the impression? Hold on. We're not gonna finish the lecture tonight. Yeah. We're not gonna finish because Delvin have to go to work for 3:14 in the morning. Yeah, man. Yeah, man. Straight up. So Israel has made medical marijuana legal. In Israel, you can get medical marijuana legal, and a lot of research into medical use of weed is done there. Yeah, man. Yeah, man. So in Israel, they've done a lot of work around the medical marijuana area. So for the people that who had for the people who had the Parkinson, yeah, they've done a lot of study in this area and found that the medical marijuana can help. Yeah, man, straight up. And the government is in full support of that. You would think that in Israel they wouldn't do that. Yeah, yeah, man. They said in Israel you think that they wouldn't do that, but the Rasta men say that Solomon, yeah, man, Solomon, the son of David, yeah, the wisest man that they said ever lived. Yeah, yeah. When he died, they state that marijuana was actually found on his grave. Yeah, yeah, man. They said the wisest man that they said that ever lived, King Solomon, when he died, they actually found marijuana on his grave. I don't know who true that is, and I don't know where that is written, and I don't know who testified to that, and whose testimony that is. Yeah, but marijuana was on his grave. I don't know if it's the wise or wise or because he was so wise, why the marijuana was actually attracted to his grave. Yeah, or it symbolizes that wise people are associated with marijuana. If you smoke it, then you can actually be wise as well. I think that's what it is. I don't think it had to do with no reality of no marijuana and the grave or anything, but people want to associate the actual herb with helping you now to be wiser. I don't know how true that is, but I don't need it to be smart. You just read. Just read. Just read. Yeah, man, just read. Taking knowledge. Yeah, man. Straight up. The marijuana also helps with Crohn's disease. So cannabis may be helpful with curing Crohn's disease. Crohn's disease is an inflammatory bowel disorder. Yeah, that cause pain, vomiting, diarrhea, weight loss, and more. But recent study in Israel again shows that smoking a marijuana joint considerably reduce Crohn's disease symptoms up to 10 in 10 out of 11 patients. So this one is real. This is a bummer. 10 out of 11 patients after smoking marijuana showed a reduction in the symptoms of Crohn's disease. Yeah, man, and it caused complete cancellation of this disease in 5 of those patients. And as a result of the use of marijuana, 5 of the 11 patients didn't have Crohn's disease anymore. It disappeared. Yeah, man. All right, but there's a disclaimer here. It says this is a small study, but the researchers have shown similar results. And the cannabis from the cannabinoids from the cannabis seem to help the gut control bacteria and intestinal functions. So yeah, instead of the bacteria inside of the stomach now destroy the lining of the cells now, which cause Crohn's disease. Yeah, the cannabizoid, yeah, the marijuana now, it help the gut now to control the amount of bacteria that's in the stomach and the intestinal and in the intestines. Straight up. It decreases the symptom of um okay, okay, forget about that one. Yeah, man. It lessens the side effect from hepatitis C. Yeah, man. And increase treatment effectiveness. So if you have hepatitis C, yeah, it lessens the side effect of hepatitis C and it increases the treatment effectively. All right. So we're gonna go through this quickly because Delvin have to go to sleep. Yeah, it decreases anxiety. So if you have anxiety problems, yeah, marijuana, it decreases anxiety. So you're anxious about things, you get nervous, you can't, you get, you're running late and, you know, you have an important appointment, you start to get itchy, sweaty, all of these things. Yeah, the marijuana now helps reduce anxiety. Straight up. Mhm. All right, so I'm not gonna get into a lot of the details. I'm just gonna tell you some of the things that it does, so that we can wrap up the show faster. It helps reverse the effect of tobacco and improve the lungs. So the damage that tobacco does to your lungs and your body, smoking marijuana can actually reverse. Yeah, man, that effect. Oh God. Yeah, man, smoking tobacco can actually reverse the effect. So, smoking marijuana can actually reverse the effect of what tobacco does to your body and your lungs. It says I'm going to read this one. In 2012, a study published by the Journal of American Medical Association shows that marijuana improve lung function, yeah, and even increase lung capacity. Researchers looking for the risk factor of heart disease tested 5,000 people, 5,000 young adults over a period of 20 years and found that only users of marijuana, um, that pot users showed an increase in lung capacity. So your lung will actually get stronger, according to this, as a result of the marijuana, compared to tobacco smokers who lost lung functions. So tobacco now, destroy your lungs. Yeah, straight up. You have problems breathing and all of these things. According to them, the marijuana help you to breathe better. Yeah, it's believed that the increased lung capacity is due to the deep breath taken while inhaling the marijuana and not from a therapeutic drug. Yeah, so straight up. So the deep breath that you take to inhale the marijuana now, that help to strengthen the lungs, and the lungs get stronger. Yeah, man, that's what it says. Yeah, man, that's what it says. That's what it says. Yeah, man, marijuana reduce severe pains and nausea from chemotherapy and stimulate appetite. Yeah, man, it make you nap. Marijuana make you eat. Yeah, man, straight up. And if you have a lot of pain and nausea from chemotherapy, marijuana actually reduces those effects. Yeah, man, if you have like what do you call it now? Yeah, what's that thing in the one-sided thing? Migraine problem. It can help. That's what it says here. Marijuana improves symptoms of lupus and immune disorder. If you have lupus or immune disorder, marijuana can help that too. It improves it. Big up yourself, Rosemary Matthews. I love you, girl. Thanks for joining Unscripted. Anything goes. Yeah, man. It says marijuana protects the brain after a stroke. If you smoke marijuana after you've gotten a stroke, yep, marijuana can actually protect the brain from after the stroke. Straight up. Rastafari. But read that one there. It says research done on rats, mice, and monkeys from the University of Nottingham shows that cannabis may help protect the brain from damage caused by stroke or reduce the size of the area of the affected by the stroke. Mhm. This is the only research that have shown um, neuroprotective effect of cannabis. Some research have shown that the plant may help protect the brain after other traumatic event like a concussion. So when you have a concussion, that means you get like hit in the head or something knock you out. Yeah, yeah. Smoking the marijuana can actually help protect the brain after some such traumatic event to it. Yeah, man, straight up. Instead of doing damage, it can actually help to protect it so you minimize the risk caused to the brain. All right, let's continue here before we wrap up the show. All right, marijuana helps veterans who suffers from post-traumatic stress disorder. Yeah, so people who goes to war and have those um, flashbacks and it send them into some form of depressive state that's called post-traumatic stress disorder. That means they were exposed to actually things that it's hard to deal with after coming back from war. Yeah. So it's called post-traumatic stress disorder. So marijuana now helps them. I think it helps them to forget it. Like, how Raquel says it calms her down and all of these things. I think that's what it does. It calms them down and have them forget about this act of war functions that constantly harm them. Straight up. It control other type of muscle spasm. So just like it's a sedative, it's a relaxing agent, the marijuana. Yep. So it helps now. Yeah, man, muscle spasms. So if you're one of those people who suffer muscle spasms, it helps. It treat inflammatory bowel diseases. So if you have bowel problems, yeah, your what do you call it now? Your colon, gets swollen, and you have inflammatory bowel disease. Yeah, it's hard to poo without having pain. Yeah, yeah. So this marijuana now can actually help to calm that area, so you are able to, yeah, man, do your thing properly. Yeah, man. Straight up. It helps eliminate nightmares. So if you're one of those people that jump up out of your sleep at night times because you're, you know, afraid of the witch, yeah, yeah, but something is scaring you in your sleep. Yeah, so marijuana now helps you to sleep comfortably and cause you not to have nightmares. It helps, according to this. Yeah, man, it protects the brain from trauma and concussions, as we stated earlier. Yeah, man. So those are some of the things that marijuana medically, based upon the research done by the universities and studies, that it can help marijuana. So if you're considering marijuana to help you, then go and see your doctor and tell your doctor to, you know, recommend you to a person specializing in medical marijuana, a medical doctor, that sorry, a medical pharmacist that specializes in marijuana, and have them provide you the proper, you know, strain of the marijuana that will help you, and hopefully it will help you. You understand? Hopefully it will help you. I, Delvin, I don't believe in smoking, but it's not for me to say what's best for you, right? And your medical needs. It's up to you and your medical practitioner. Straight up. Yeah. If you, in my opinion, instead of smoking it, I would suggest that you eat it or vaporize it. Yeah, vaporize the extract. hmm But as far as the smoking of it, I'm not. I don't subscribe to that. But to each his own. Yeah, to each his own. Yeah, man, people. That is the positive effect of marijuana. Yeah, man, straight up. That is the medical benefits of it. Yeah, from what I have here. So Delvin has to go to bed now, so we're here tomorrow again at 7 o'clock. So remember to embrace conservative values. We don't have badges nor guns, so we must support the police. Until tomorrow at 7 o'clock, Delvin will be here. I want you to know I love you. I love you. Bye bye.